Hello there, everybody. We have seen from previous clips of the Victorian throwback Jacob Rees-Mogg inviting people onto his show, where he thinks he is so much more intelligent than they are, he will be able to thrash them into an intellectual oblivion. Unfortunately for Jacob, he doesn't seem to be aware by just how much he overrates the power of his brain, and oftentimes ends up with egg on his face, constantly interrupting his guest and cutting them off when the going gets tough. Well, this is another one of those occasions. He decided to dedicate some time to pushing for the privatisation of the NHS. His guest is Bob Gill, an NHS doctor who is passionately against the privatisation of our health service. Rees-Mogg attempts to back the doctor into a corner, but as per usual, ends up being taken away on the metaphorical stretcher. Let's take a look.
Discuss the ceaseless sobbing from the unions, which reached a new peak today, as Unison, British largest trade union, claimed that £1 million a week is being spent on private ambulances. But I'm afraid there's nothing new to this. Use of the private sector to support the struggling NHS is routine. And while the merest mention of the word privatisation has become heresy against what the late Nigel Lawson called England's national religion, we haven't yet got the law de heretico combrendo, but we're not far off it. The private sector is efficient, and using it will take us closer to the superior Australian or possibly even the Japanese system, in which healthcare is paid for by the state but can be provided by private companies. Joining me now to discuss this is the GP and producer of the great NHS heist, Dr. Bob Gill. Dr. Gill, thank you so much for joining me. Isn't it sensible to use private resources to help out the NHS as long as the free at the point of use principle remains?
No, the private sector is interested in generating profit. They do this in healthcare by avoiding sick and expensive people. When they have been used in the NHS, they often cherry pick. That means they take the simplest cases, the most profitable cases. When clinical services started being outsourced in the early 2000s under Tony Blair, they were being paid more per operation than the NHS was. So they cherry pick, they cream off the easiest, most profitable work. And as we see in America, the most privatized system in developed countries, they have to have the state to step in a dysfunctional system by providing Medicare for children and the poor, and Medicaid for the elderly. In fact, that's the other way around. So private medicine doesn't work. Healthcare is a natural monopoly. Kenneth Arrow back in the 60s won a Nobel Prize in economics for working this out, because we have a problem in the market. Market drives profit, and profit is not to be found with the very sickest of patients.
But profit drives efficiency, and the NHS is not efficient. That's quite clear. And we have long waiting lists, and the private sector can reduce some of those waiting lists. And yes, it can make a profit, but that actually means it is competitive and wants to see more patients. Whereas actually in the NHS, you get the same amount of money even if you don't have the flow through of patients.
Okay, so let's look at two examples of the private sector helping us out in the NHS. First of all, private finance initiative. This is a financial scandal of private financiers.
The private finance initiative was a ridiculous scheme of Gordon Brown's, primarily, to get off-balance sheet financing. That was a fiddle. Let's stick to the provision of healthcare rather than of the PFIs, because they were a government swindle.
I'll just step in for a moment briefly, because Rees-Mogg is being typically deceptive here. PFIs, or private finance initiatives, were actually a concept of John Major's Conservative government, but were mainly implemented by Tony Blair's government. In very layman's terms, PFIs were schemes where new hospitals were funded, and not by the Treasury, but these projects were opened up to bids from private developers who built the premises and leased them back to the government. The reason it's a scandal is because some of the interest payments to these developers were and continue to be obscenely high. And that means some NHS trusts have found themselves in significant debts to these developers. The overall long-term cost of PFIs is far higher than if central government had just paid for the building of these hospitals themselves up front. But of course, Rees-Mogg, being the slimeball that he is, doesn't want to focus on that part of privatisation within our health service because it paints a devastating picture of the effects of any kind of privatisation in our health service. So he's trying to be slippery here by pushing the conversation back to focusing entirely on the delivery of patient treatment. Again, all very underhand.
The private sector.
But let's talk about hip operations where you can get more done faster on the private sector.
There is no country in the world that delivers universal comprehensive care in a private system. In a private system, you need a parallel bureaucracy. We had an amazingly efficient system. We collected money through general taxation, but in order to get all these contracts with the private sector, you need a market, you need a bureaucracy. In 2006, the Bloor report from York University estimated that the increase in cost due to marketisation sucking out 10% of the NHS budget. PFI, we borrowed 11 billion.
We've got a waiting list of 7 million people.
It does not sound like efficiency. This is a totally bogus argument.
Nobody believes the NHS is the best in the world anymore. There's a waiting list of 7 million that private hospitals can provide a service, they can provide it in a cost-effective manner, and they can ensure people get treated. Surely this is a good thing.
It's not a good thing because we've had 10 years of austerity on the NHS. We've had a stagnation in funding.
We haven't. We're spending records amount on the NHS.
If you let me finish my point, the funding of the NHS historically has been 4%. We've had a decade of defunding at 1%. The government have created a problem for which it has a predetermined solution. And in July
as a percentage of GDP, we're spending as much as our nearest neighbours.
And
it's gone up and up. I've got to move to my panel, so I'm sorry to cut you off, but thank you so much for joining me. We disagree fundamentally, but a lot of bad figures are bandied about.
Oh dear. Another day, another battering. Another occasion he decided to run away rather than confront the opposition because he had 2 people on his panel who were more in tune with his views on privatisation, Toby Young being one of them, by the way. It really is embarrassing people look up to this weasel like he is an authority on any subject. Going back to what was said there, everybody knows the austerity years as what has led to the disgraceful lengths of waiting lists. Almost 1 in 10 people are requiring some form of NHS treatment, and the man sitting in the chair telling us privatisation is the answer almost certainly has blood on his hands. His party, the Conservative Party, have ruined the NHS, so the absolute barefaced, brass-necked cheek of it for him to sit there and say nobody believes the NHS is the best in the world anymore, when people genuinely did believe that prior to Tories taking office. Should he not be ashamed that he has been partly responsible for running into the ground an institution that was the envy of the world? The most devastating point of all, though, one that Rees-Slug knows is true, is when the doctor says, the government have created a problem for which it has a predetermined solution. Absolutely 100% correct. And we have to fight against this. We have to fight against this push towards privatisation. It's been allowed to creep in gradually, but hopefully we can put a stop to it at some point. I haven't necessarily been encouraged by things I've been hearing from Wes Streeting, because the 3 people on this panel, Jacob Rees-Mogg, Toby Young and Stephen Pound, all agreed with certain things Wes Streeting was saying regarding the NHS. And that's really worrying, because you should never be getting praise for things you say from this guy. If you're getting praised by this guy, you've gone wrong somewhere, okay? You've gone very, very wrong. Anyway, cheers for watching. I hope you enjoyed that. Have a lovely day and take care. Bye-bye.